A runny nose is one of the most common symptoms people experience, but it can stem from various underlying causes, including allergies, the common cold, and COVID-19. Although it may seem like a minor annoyance, understanding what is causing your runny nose is important for proper treatment and preventing further complications. Overlapping symptoms, but they each have distinguishing features that can help identify the root cause. By recognizing these differences, you can take appropriate measures to relieve your symptoms, minimize discomfort, and avoid spreading illness to others. We'll provide an in-depth examination of how allergies, colds, and COVID-19 contribute to a runny nose, the symptoms that accompany each condition, and the most effective treatments available. Identifying the correct cause of your symptoms will help you recover more quickly and take precautions to protect those around you. Understanding a runny nose. A runny nose, medically known as rhinorrhea, occurs when excess mucus is produced and drains from the nasal passages. Mucus serves as a natural defense mechanism, trapping harmful particles like dust, bacteria, and viruses before they enter the respiratory system. However, when excessive mucus production occurs, it can lead to congestion, frequent sneezing, and postnasal drip, where mucus drains down the throat, causing irritation and coughing. The consistency and color of mucus can provide clues about the underlying condition. Clear and watery mucus is commonly associated with allergies, whereas thick, yellow, or green mucus may indicate a viral or bacterial infection. Infections tend to trigger inflammation of the nasal passages, leading to swelling and congestion that can make breathing more difficult. Understanding how and why a runny nose occurs can help differentiate between various causes and guide the selection of an appropriate treatment approach. Allergies, a common culprit. What causes allergy-related runny noses? Allergies occur when the immune system mistakenly identifies a harmless substance, such as pollen, dust mites, pet dander, or mold, as a threat and overreacts to it. This overreaction leads to the release of histamines, chemicals that cause inflammation, increased mucus production, and irritation of the nasal passages. Unlike infections, allergic reactions are not caused by viruses or bacteria, but by the body's hypersensitivity to allergens. Seasonal allergies, also known as hay fever, are triggered by environmental allergens like pollen, which are more prevalent during certain times of the year. Perennial allergies, on the other hand, occur year-round due to indoor allergens such as pet hair, mold spores, and dust. The severity of symptoms depends on the individual's level of sensitivity to the allergen and the duration of exposure. Some people experience mild symptoms, while others suffer from severe nasal congestion and persistent sneezing whenever they encounter their specific allergens. Symptoms of allergies. Allergy-related symptoms often include a clear, watery nasal discharge, sneezing, nasal congestion, and postnasal drip. One of the most distinguishing characteristics of allergies is itchiness in the eyes, nose, throat, and ears. Many individuals with allergies also experience red, watery, or swollen eyes, as well as increased sensitivity to light. Unlike viral infections, allergies do not cause fever, body aches, or fatigue. Symptoms often worsen upon exposure to allergens and improve when the allergen is removed from the environment. If you notice that your symptoms occur during specific seasons or when you are in certain environments, such as near pets or dusty areas, allergies are the likely cause. Some individuals experience allergy symptoms for weeks or even months at a time, particularly if they are consistently exposed to their triggers. Recognizing these signs can help differentiate allergies from colds and infections, leading to more effective symptom management. Treatment for allergies. Allergy treatment focuses on reducing exposure to allergens and relieving symptoms with medications. Antihistamines, such as cetirizine, Zyrtec, loratadine, Claritin, or diphenhydramine, Benadryl, help counteract the effects of histamines, reducing sneezing and nasal congestion. Nasal corticosteroid sprays like Flonase and Nasacort are effective for reducing inflammation in the nasal passages. Decongestants such as pseudoephedrine, Sudafed, can provide temporary relief from nasal congestion but should not be used long-term due to potential side effects. For individuals with severe allergies, Immunotherapy, allergy shots, may help desensitize the immune system over time. In addition to medication, limiting exposure to allergens by using air purifiers, washing bedding frequently, and keeping windows closed during pollen seasons can help manage symptoms effectively. The common cold, viral but mild. Symptoms of a cold. Cold symptoms usually develop gradually and include a runny or stuffy nose, sore throat, sneezing, mild fever, coughing, and fatigue. Unlike allergies, colds do not cause itchy eyes or prolonged symptoms that persist for weeks. The mucus from a cold may start out clear and watery, but often thickens and turns yellow or green as the infection progresses. Most cold symptoms peak within the first few days and gradually improve. If symptoms persist longer than 10 days or worsen over time, a secondary bacterial infection, such as sinusitis or bronchitis, may be present. Rest, hydration, and over-the-counter medications such as decongestants, pain relievers, and cough suppressants can help alleviate symptoms and speed up recovery. COVID-19, a more serious concern. How COVID-19 affects the respiratory system. COVID-19 is a viral illness caused by the SARS-CoV-2 virus, which affects the respiratory system and can cause mild to severe symptoms. While COVID-19 can present with symptoms similar to those of the common cold and allergies, it has distinct differences that can help with identification. COVID-19 is highly contagious and spreads through respiratory droplets when an infected person coughs, sneezes, or speaks. Unlike the common cold, COVID-19 can lead to severe complications, including pneumonia and long-term respiratory issues. Individuals with underlying health conditions, older adults, and those with weakened immune systems are at higher risk of developing serious complications from COVID-19. Symptoms of COVID-19. COVID-19 symptoms can range from mild to severe and often include fever, fatigue, cough, shortness of breath, loss of taste or smell, body aches, sore throat, and gastrointestinal issues such as nausea or diarrhea. A runny nose can occur, but is usually accompanied by other symptoms that set COVID-19 apart from colds and allergies. The most notable symptoms that differentiate COVID-19 are loss of taste or smell, difficulty breathing, and severe fatigue. Unlike allergies, which cause persistent and predictable symptoms, COVID-19 symptoms tend to develop suddenly and progressively worsen. Fever and chills are also common, which are not present with allergies and are rare with colds. How to tell if it's COVID-19. If you have a runny nose along with fever, cough, body aches, and loss of taste or smell, COVID-19 is a strong possibility. Testing is the most reliable way to confirm a COVID-19 diagnosis, as symptoms can vary among individuals. If you experience difficulty breathing, persistent chest pain, confusion, or bluish lips, seek medical. Thank you for watching this video on differentiating between allergies, the common cold, and COVID-19. We hope you found the information helpful in understanding your symptoms and finding the right treatment. If you enjoyed this content and want to see more health-related topics, please hit the like button and subscribe to our channel. Don't forget to turn on notifications so you never miss an update. Stay safe and take care. Attention immediately. Unlike colds and allergies, COVID-19 can lead to severe respiratory complications that require hospitalization. Treatment and prevention of COVID-19. There is no specific cure for COVID-19, but treatments focus on managing symptoms and preventing severe complications. Mild cases can often be managed at home with rest, hydration, fever reducers, and cough suppressants. For more severe cases, hospitalization and oxygen therapy may be necessary. The best way to prevent COVID-19 is through vaccination, mask wearing, and maintaining good hygiene. Regular hand washing, avoiding crowded places, and staying home when feeling unwell can help reduce the spread of the virus. By identifying whether your runny nose is caused by allergies, a cold, or COVID-19, you can take the appropriate steps to treat your symptoms and protect yourself and others from illness.